After listening to Ernest and those who precede, and being the last person to speak before you go eat, your breath kind of flies out of you, or you stop breathing for a second. There were some great stories, and thank you, Ernest, for what I heard. DR Congo, yes, the name is C. And you have so many C's in that country: copper, cobalt, gold, but this is a carat of gold, carat of diamond, you name it, the C's are there. Coffee, and at the same time I wonder, the last word couldn't be curse? That's possible, maybe. I was born in Congo, and my father was from an average family. He was the chief of a station, railroad station, so we had something to put in our tongues here and there. But he died suddenly when I was in high school, and everything changed from that time. I finished my high school with my four sisters behind me, having almost nothing afterwards. My older brother went to university. Luckily for me, I went to the States. The ticket was paid by one of my uncles. In the States, I decided to do medicine because I was very frustrated as I lost my father because he had an acute appendicitis. And that was unthinkable. How could I lose my father that way? I became a physician, happily married with another physician, had a beautiful child, started going back home on vacations. Unfortunately and sadly, I lost 5 siblings, 3 with HIV, 1 in an accident, and 1 had cancer. And I said, do I have to be in the US? This makes sense. So I decided to go back home. But I wanted to show what the Congo is compared to the US. If you take Alaska and Hawaii, Congo will be about 1/4 of the size of the United States. And those dotted lines that you're seeing there are the paved roads of Congo beside the cities. My first return there, the first few months, I ran like a dog. I couldn't deal with it. I went back a year later, the same thing I ran. The 3rd time I ran. And the 4th time I said, I'll stay. Unfortunately, that's the time when you have all these lootings and everybody's trying to get rid of Mobutu, all the killing that took place. I stayed. I stayed and lost virtually everything I had brought back from the state. But this is not my story. What hurts me the most is we're talking about malaria, we're talking about HIV, we're talking about acute respiratory infections, we're talking about hypertension. And sadly, there's something's happening in Africa that we are overseeing. The death of women who are bringing joy to this world, having babies. No one is saying much about that. You turn around, most of us are saying, well, we have to do something about HIV. But before I go into detail, let me just show a few information about DR Congo. I think my friend Conte said that. We have 6 million people roughly in the country. The crisis, you name them, we have millions of them there. The wars, we have 16 since 1960, and 4 million to 5 died during those last one that we just had. The tribes, about 400. And women have on average 7 kids. Prevalence of contraceptive methods is 4.4, and literacy among the women is about 44, which is unthinkable in the US. What are the challenges with all this in our hands? Maternal death, a huge one. 1289 per 100,000 live births. If you have to put all these women, if you calculate quickly, the number of women who can give birth in our country, roughly you have something between 18 and 24,000 women dying every year. If you have to pack them in a jumbo jet, you'll have something like 40 to 60 jumbo jet crashing every year in that country. Children between 0 and 5, you have 213 out of 1,000 die every year. This is the situation in Africa. As you can see, Congo, Angola, Ethiopia a little bit, and you got in Mozambique here, you have over 1,000 and above of women who, the number of children die because they came to this earth. And you can see the northern part of Africa and a little bit South Africa, around Nigeria, we have less death than in Congo. Sadly, we as physicians sometimes overlook this, but working in a project that was funded by USAID, this made me think, what is the role of an African, a Congolese woman in that society? And this is what I found out. Mother of many, 7. That's one his role. Housewife and provider, with what? Sometimes I wonder. Worker, producer, and financial person. These ladies, I met them not long ago. They woke up at 4 in the morning. They woke up at 4 in the morning. They walked 27 kilometers to go pick up what they have on top of their heads. It's cassava, wet ones, roughly a sack of cement on top of their head. And they will go back home to fix some chikwang, which is something like fufu, and then sell it. And I asked them, the whole thing they had on top of their head was worth $27, the 3 of them. And this woman at the end has to cook for the husband and be pregnant and have a baby. These are all the women, and usually in Congo, I don't know about other countries, but the woman is always a second-ranked person. These are old women at that age. They're still going to the field to bring something back home while the guys are sitting and enjoying themselves, sometimes having a couple of beers, or local wine or local beers. Major maternal health issues. Hemorrhage in those places, in the health centers where we are. Malaria during pregnancy, you have seen that. Most of them do die because they become anemic. HIV and TB, sexually transmitted diseases, malnutrition, that's another issue. This is an example. What happened to a child born by those mothers? I'm fine in a hospital where I can take care of, but this child, what happened to him? Underweight, malnourished, any illness, the child is gone. We had a Sound Throw program that was funded by USAID, and we did a few things to try to improve these conditions. We vaccinated our children. Curative care, these are some of the physicians we trained, the nurses we trained, so they could take care of our mothers giving birth. Prenatal care in most places. Well child care, there's something we did with USAID support. And we distribute treated bed nets to all the women who came for prenatal care to try to fight malaria as much as we could. Blood safety was something else we did also. We distribute drugs throughout the country. We were about 100 health zones. DR Congo has about 300. We just created 7 more, 300 more, so we have 500 something health zones in the country. You can imagine what is undone out there. We gave water and teach people sanitation. We train health teams on site where we were. And these are the few results. we did improve actually the vaccination from 40-something to 90-something%. Obstacles and difficulties that we face while doing that. These are the guys who tend to kill our villages. Nothing happened without them. If you have to go to the hospital, he has to see you first to give you something to protect you against what's going to happen there. Or when it rains, so he can dance and stop the rain. You can think of all the things you can think of. These are some of the guys who are miracle guys, I'll call them. But these guys are obstacles to our societies. They create attitudes that we have a hard time dealing with. Accessibility, the roads, trucks stuck in the middle of nowhere. A few examples. Communication. I must thank Conte, because without his system with Vodafone, I don't know what we would have done. But this happens. The person is sick, has to be transported from one place to another. He dies in the middle. Quality care is an issue. And I think my brother was screaming here, we need to give quality care. And so unfortunately for Congo, most of the physicians are going to South Africa, to Europe, to the United States, because they're earning less, as Chris said. So we are training nurses to do the job of physicians. Poverty is a problem. How do you solve this? Where do we go from here? Poverty, here you have a mother, a child, a father trying to fix a road for $1 each for the day. Literacy, another problem. These kids actually are not reading. They look at pictures of public health booklet we had. They can't read. Institutional health care. This mother just had a baby a few weeks ago, and I was there. Same here. 2 children, one a baby, another one a baby beside the woman. Where's family planning? Premature motherhood, 15 years old. This is a place where our kids come out to see the world. This is actually a delivery room. That's unthinkable in the US when I was working there. And what's needed? This is a confusion, because if we have to sit down in the office to discuss this, it will take days and have sessions, and nothing comes out afterwards because the reality is elsewhere. What is my vision? Involvement of all. That's a must. All of us have to be involved so that our kids, our mothers, don't die with something that is joy, that should bring happiness to everybody. All of us have to be in. What can we do? Here I want to make sure to the African men to treat our women with dignity. That's something we don't do. I'm very sorry. We are the same. We cannot be outside until 3 in the morning and come back home and try to have sex with her. She's a thing. That's not right. Promote laws that protect women in our countries. We cannot be having second bureaus like we did with Mobutu, third bureaus. A woman became an office. That's illegal. We shouldn't be doing that. Educate our children, especially our daughters, so they can become women who can stand up and be themselves and be productive. We got to teach our children, our women, our kids, especially our daughters. I'm not saying we should abandon the boys, but the girls need to be taught so they don't become women with 150 kilos on the head walking, earning $20. That's abnormal. Have well-trained personnel is crucial so we can stop hemorrhage of those women when they come in, so we can take care of them before they have the babies properly, instead of having nurses who have nothing to do with them and watch them die. So it's important, training. We need to train our healthcare personnel. And the equipment, as you can see, how can you take care of someone in a condition that don't make any sense? We need infrastructure and equipment so that those women do not die bringing a child to life. And finally, our leaders in the government. A lot has been said about them. And it's sad that these leaders are incapable of seeing what we are seeing. But when you don't have love, it's hard to love another person. When you don't have compassion, it's hard to look at the other person. Our leaders need to change. Our leaders need to understand. Our leaders need to see an Africa that is different, with children are strong, with our women are strong. Thank you very much.
I'd like to ask a question on that.
Leon, when I came across your work, I think one of the pieces I read was in Time magazine. And one of the things that struck me was the fact that you were focusing on the rural infrastructure, or the rebuilding of the rural infrastructure in the Congo. How do you see what you started as continuing? How do you see it as becoming sustainable? What sort of inputs would you need to sort of build upon what you've done so far?
Emeka, to be frank with you, sometimes I get very frustrated and discouraged to see that our leaders don't understand yet. As you saw, you're trying to take medicine somewhere and you're stuck for weeks, and sometimes the drugs deteriorate, you can't do anything with. The vaccines are going bad. And most of the time when you talk to these leaders, their first interest is what goes into the pocket, and that hurts. That hurts. I think sustainability is a very big issue. I'm thankful that USAID continue to assist us for the next 3 years again. What we did is to develop some parallel activities beside the healthcare for these people. When you earn $1 a day, when you have a country where the users fee for your healthcare, obviously you're going to have people who are going to stay outside the healthcare system, and they'll take care of themselves, or either some witch doctor or something.
Leon,
so,
what would it take to persuade other Congolese doctors? I mean, there's several hundred thousands of Congolese doctors who've been trained and are basically working in the US or Britain or Europe. You've come back because of your own vision. Maybe others wouldn't do that. Can you imagine a program that would bring more people like you back?
I started a program which we are training family physicians. Those family physicians, we are 29 right now. We are working with the South Africans, Medical University of South Africa, Medunsa. We were training as a physician for 4 years to be family physician. And what I've tried to show this guy, that it's possible to leave home. It's possible to make money at home. They can have groups, not wait to go look for a job, but to come up with groups that can provide quality care. Show some compassion. You have something like one physician to 50 to 100,000. So if you can put a group of physicians together, giving quality care, because we don't want to have a quality care. I mean, you have to pay $1 million to be treated. So it is possible if you together, as a team, reduce the cost of medical care to these people, you'll make enough money to survive. I've succeeded with 6 of them. They're back home running big hospitals in Kimpese, which is a big hospital in Congo province. I have some of them in Karawa, which is up north. And some just graduated the 26th of May. They decided to go back with me. So I'm not saying I'll succeed doing everything, but it's something I would like to try.
Well, Leon, I'm sure the entire audience wishes your vision the greatest success going forward. Thank you so much.
Thank you.